Yes.
You can start now. Yeah.
Yes. Thank you, Hindi team. Now we are moving to English session. Today is our 1521st day of continuous webinar. All of you are known about Dr. THANZULA KHALIQ. She has already taken many classes for us. So I am welcoming her to our session. She is the first lady homeopath practicing in mind method in Pakistan, and she has written lot of articles in various magazines and daily rubrics, and she is running a homeopathic school for teaching homeopathy with Dr. I forgot his name, but
Javed Akhtar.
yeah, Javed Akhtar. Yeah, Javed Akhtar. I'm inviting her for on behalf of IFPH, Dr. THANZULA KHALIQ. You're welcome. Please.
Sir, Dr. Anjani, before she starts, I must say that happy birthday to Dr. Dhanesh.
Yeah. Happy birthday to Dr. Danish. Actually, I was about to say to the wishes. Happy birthday to you. All of you can sing along with me.
Happy birthday,
Birthday to you. Happy birthday to you. Happy long life to you, Dr. Danish. Happy long life to you. So actually, for running our Zoom session, Dr. Danish is the backbone of our Zoom session. So happy long life. We are wishing long life to you for.
Thank you, Sahali sir and Dr. Ajini and all for this wonderful wishes. Thank you all.
Thank you, sir. So shall we start?
Yeah.
Thank you, Sayani sir, for reminding me. Actually, I was I was about to say, but suddenly when I'm introducing her, I started suddenly. Okay, thank you so much.
Hello everyone. Sorry for late because my patients have a very severe condition and suddenly appear in my clinic, so I'm sorry. And everyone, good evening. And thanks IPHF channels from the India. He's inviting everyone, all team members, inviting me for sharing the knowledge and my solved case. Thank you so much. This is my case. Today I am presenting the breath holding spell solved with a single remedy. And before sharing my case and detail of my case, I want to share what is the breath holding spell. This is a situation of the breath holding spell. It's a symptom. How to recognize the patient symptoms? A child may gasp, exhale, and they'll stop breathe. They may also appear pale and blue and during the cry and sometimes faint condition. What are the causes of the spell, breath holding spell? Breath holding spell can occur when the child upset, mentally upset, angry, frightened, and pain. They can also happen when a child startled or has traumatic event. This is the situation. Breath holding spell occurs in less than 1%, about 5%, otherwise healthy children among the people in our society. They disappear by age 4 in 50% if the stable family and sometimes parents the very calm people and there have no any scourge among the family members, so children's get the stable situation and these are all symptoms of the breath holding spells disappear automatically 50% in children's, and by age 8 in about 83% of the children, because they can understand and they can express their feeling. A small percentage of these children may continue to have spell into adulthood. These are all types, and two types there: cyanotic breath holding spell and valid breath holding spell. What is its meaning? A breath holding spell is an episode in which the child involuntarily stops sometime breathing and lost conscious for a short period immediately after frightening or emotionally upsetting events or a painful experience. The first type of the breath holding spell can take the two forms. First, cyanotic, and second, pallid. In cyanotic, discoloration appear on the face in a blue lips and eyes and sometimes fingernails also, and skin discoloration in cyanotic breath holding spell. In pallid, patient looking the pale. Both the cyanotic and the pallid forms are involuntary sometimes, which mean that children are not intentionally holding their breath and have no control over the spell. Involuntarily, breath holding spell are easily distinguished from the uncommon, and brief episodes of voluntarily breath holding by some children, and children who voluntarily hold their breath do not lose conscious and go back breathing normally after they get what they want or after becoming uncomfortable with when they do not get they want. With our situation, the first type is the cyanotic breath holding spell, and what is it about? The cyanotic form of the breath holding is the most common, and it is initiated consciously by young children after as components of the temper tantrum or in response to a scolding or other upsetting events. Episodes peak at about age 2 and are rare after age 5. Typically, the child cries out without necessarily being aware they are doing so, breathing out and then stop breathing, and shortly afterward the skin begins to turn blue, and cyanotic mean blue, and children becomes unconscious. A brain seizure may occur, and after a few seconds breathe resumes and normally normally resumes and normally skin color and conscious returns. It may be possible to interrupt the episode by placing cold rag on the child face when the spell begins. Despite the frightening nature of the episode, and child do not have any dangerous or long-term effects. Parents must try to avoid reinforcing the initiating behavior. At the same time, parents should not avoid providing appropriate structure for children out of fear and causing spell. Distracting children and avoiding situations that lead or to tantrums are the best way of the preventing and treating these spell. These are the sometimes patients falling in the grounds when starting temper tantrum, because children cannot express their feeling, and this is infant, and this is showing the pale and patriotic. I'm starting my case now. My patient's name is the Cheyenne, and in 2 years, and first visit in my clinic, Cheyenne was crying a lot of when entered in my clinic, and his mother was controlling him, but was refusing entered in my clinic, and he was not want to in my clinic, entrance in my clinic, and want to go back. I did not know, I was not understand the situation, but I see that the mother was the mother went back again and brought some food and drinks from the shop in with the lace chips and chocolates and Shazam juice. When finished things, and he started eating things, and when he finished things, and he started making more nice and says that mom chale, mom chale. So he was very stubborn. This I want to show this situation to you. Actually, see this. You can see this.
एकदम झुक के बैठ जाएगा तो आप फिर सांस लगाओ तो फिर सो जाएगा लेकिन दिन सोए हुए कुछ भी नहीं लेता, लेकिन फिर भी उठ जाता है। थोड़ी थोड़ी देर बाद उठेगा, फिर थोड़ी देर बाद सांस के आऊंगी, फिर थोड़ी देर सो जाएगा।
Yes, you can see this patients making noise and calling mama again and again, and he is a very obstinate children. In a few moments, the mother told me that about the information about the case, that this is my son Cheyenne, and since he was born, he was fine for a few days, but after 2 months, he has a habit of crying continuously and does not stop until he is the picked up. I have become a habit or sitting cries long time in a day. These are IPR, and mother telling about his son. I have become a habit of sitting because Shayan always need the mother laps, and I can't refuse because he is in a sometime fainting condition and stop his breath. So also have to do housework also because I'm feeling very disturbed when my children and Shayan teasing me and I will carried when he started crying. So I am never free. So sometimes I hit him or scold him. He cries a lot of, then his breathing become difficult, and sometimes he faints condition. So we also know hit and scold him. Shayan was crying a lot of when Shayan is in 2 years, but this is a bad tempered and this is increasing the situation day by day when he cries a lot of over the small things and choking and while crying seeming a very dangerous situation, but we do not know because they are visiting to doctors and treating the Shayan, but she sharing me that doctors have no understood the case or their medicine is not working. Mother was very confused because she was spent a lot of money in allopathic system and psychological systems of medicine. So in all family members are the worry about Shayan, and he gets angry at everything. If the elder brother is resting or laying down on the bed, Shayan does not like it. Shayan hits him and with the kicks and hands, brother awake and leave the bed. He was trying to my brother leave my bed. So if he no leave the bed, Shayan starts crying bitterly and stop breathe. Then we used to understand that his situation, and now we observe that while walking in a yard, Shayan sometimes walking in a yard, and if he starts crying, he falls down in these days and falls on the ground sometime. When we are not fine and we are mean family persons, all of the caring of Shayan, and he says my mother told me that when he is not found in front of her eyes, so she was and all crying in the family and informed to all people of the family, where is Shayan, please find it. So uh, uh, we have to pay attention and carefully to where he is, and then we keep him in front of our eyes. After that, we all starts looking for each other and ask each other and what Shayan is, what he is doing, and where he is. I given the single remedy chamomilla. Pansy was the 1 ml, and I taken the rubrics, temper tantrum, inconsolable children's, and carried desire to be carried, mother's lap, comforted. I can show my radar. Oops. This is temper tantrum, inconsolable children. Temper tantrum have the 86 medicine. Inconsolable children have 6 medicine. Carried desire to be carried, mother's lap comfortable on have 10 rubrics, 10 medicines, and it has the front dispose. So I want to show is a front dispose. You can see this front.
Yes, yes, the question of the thought. क्या मांग रहे हो मामा से? मामा से क्या मांग रहे हो? क्या लेना है? क्या लेना है? चीजें लेनी है? घर जाना है? क्या कह रही है? क्या लेना है?
This is the anger situation, and this is the front dispose. When forehead, contracting his forehead, and when father looked with the anger mood, he cannot bear, and shaking within anger, and a tantrum starting now. Then he want to hit his father, and sometimes so because he is not appear the anger looking at his. So it was the chamomilla, and I want to show his chamomillas. This is the chamomilla keynote, because chamomilla have the irritability of the nervous system and anger. And mother told me in video that sometimes less sleeping, have less energy, and I want to share some chamomilla informations and some of important rubrics. These are all the tantrum rubrics basically. Tantrum, this is temper tantrum. Temper tantrum is the rubric connect with the psychology, and but I have the mixed with the different emotions, weeping, delirium, anger, anxiety, fear, and a lot of things occurs in this situation. So weeping and offense and imaginary, and sometimes biting, behavior problems, and throwing things around the people around him. These are all the situations we can add the tantrum. What is the temper tantrum? Temper tantrum are the unpleasant and disruptive behavior, emotional outburst, and toddler want to express themselves but find it difficult. They feel frustrated, and the frustration come out as the tantrum. Temper tantrum usually starts at around 18 months, and every common in toddlers, and hitting the and biting are common too. One reason for this is the toddlers to express themselves, but temper tantrum usually started at around 18 months and are very common in toddlers. Hitting and biting are common too. One reason for the for this toddler want to express themselves but find it difficult. They feel frustrated, and frustrations come out as a tantrum. These are all the situations of the temper tantrum. These children, and mother is very showing the different, because this is how to understand the inconsolable children. Inconsolable crying, basically. Chamomilla children is a inconsolable crying. When a baby infant cries and fusses, even when parents try to comfort them, but they are failed in this situation because it's a very stubborn and did not like even we can say that inconsolable children's rubric, they are throwing things, and if the parents giving the toy, he is not accept. Abusive children, parents sharing the parents children insulting, and sometimes he is not accept the nursing and even newborn. Why newborn refuse to nursing and aggravation after nursing, aggravation after the feeding? Why is we should to must know about this, and children kicking, and even anyone carried the children, he want to kicking children and carried children become stiff and kick back. So this is the children's temperament basically, and especially chamomilla have a different tantrum, and a lot of rubrics about this. I want to share something. These are all chamomilla children's, because due to the tantrum playing role in the society, in classroom and in a family, these children's crying, why crying, and mother is why worry. Anger, milk of the mother, suppression of the milk, anger passes. We are read the rubrics before this, because there is a bad-tempered receiving from emotions from the mother by placenta during pregnancy and by feeding after the birth. So children's got bad temper from the mother. What happened with the mother? This the explanation of the medicine telling us. This is the, we can see that, and because sometimes we are case taking about the mother, and this is a very necessary part of the case taking. When infants cannot expressing, cannot speak, so we should do must the case taking about the mothers. This is the ailments from the anger, indignation, silent grief, suppression, and bad news, contradiction, disappointment, excitement, fear, fright, grief, and all of the reasons, offended sometimes, reproaches, grown unhappy, and these are all the situation of the, and children got the receiving all bad emotions from the mother. So he showing the anger by the weeping, crying, and because mother also in anger and suppression the milk in this result. because anger and every bad tempered, every bad emotion have the reaction on the female, male, and every human. Because a human with the full of emotions, showing the a healthy persons can receive from all of the society, social and business and everything in all society, and nationally, internationally, environment affected the people. So there is the change of the emotions. It was the single chamomilla. There is in homeopathy we are select the state always, and what is the state, mental state of our patients. Patients in the, because chamomilla have the temper tantrum, and the mostly parents shares about their children's my infant and children's are very hard, very feeling anger is very easily. No, I can't touch it. No, don't touch it, don't touch. He will cry. So you will badly cry and stop the breath. Please don't touch my child. So you should to understand this is camera, single camera, because there is the situation, patients in the anger and stiffening out of the body and bending backward. This is a single chamomilla. Always stiffening in an anger mood. Sometimes patient chamomilla is a very obstinate and stubborn baby. He is mostly demanding everything. If the father taking the tea, and tea is very hard, and children demanding the catching the cup, but the father, now this is a very hot and I can burn my child. So sometimes he is refused to give the a very hot cup of tea, but children cannot bear this, and suddenly involves in the temper tantrum and anger, and becomes stiffening during this and crying bitterly, and mostly he is the uh, stop the breath. So there is, I want to share how to stop the breath and how to we recognize the breath holding spell. This is
Okay.
now this is unconscious and become a sign,
There's testing.
and then conscious now, and after some time he will awake automatically. This is the situation of the. This was the breath holding spell. Biting dentition during chamomilla and phytoleptrin. These both medicines are working in this situation. Sometimes lot of biting, because sometimes patient irritate and itching in the gums, and sometimes swelling of the gums, and a lot of people using the silicea, and a lot of people without understand the case giving the silica. But I advise to all of you, please don't prejudice and always follow the Master Hahnemann. He was says that and write the organon for all of us, and we should must follow this. And this biting dentition during is only chamomilla and phytoleptrin, because sometimes patients showing the irritation, showing the obstinate and stubborn because we want to catch something for biting, and he is the demanding of something for the biting, and this is only this. These are 8 medicines: chamomilla, conium, protontic, and lyconus, and sanguinaria, and 2 other layers. Anxiety, pressure from epigastrium. Chamomilla, basically, why pressure in epigastrium? Because of the bulimia and coffee aggravation and gastric pressure also sometimes. And maybe his emotional issue, and during the stress, during the depression, chamomilla when eating the food and drinks, taking the drinks, so it can involve in this situation. But these are 2 situations, and have many more: anxiety, pressure. This was the chamomilla presentations, and this was my share. And have any question, please?
Yes, thank you, Dr. Sila. As always, it's a wonderful presentation. It once again reiterates the fact that homeopathy is a totally practical system of medicine, no much complicated system, no much technicalities, and without harming the patient. This is a wonderful presentation. So it's time for discussion. Those who would like to participate, please raise your hand. It's up to you to respond accordingly or properly. It was a piece of genius work done by Dr. Ansila. You all know the Ken material exercise. Nobody knows the child what the child wants, but the homeopathic physician does. It requires a dose of chamomilla. That much irritability. Nobody knows what does it want, but it shows all sorts of irritability, disturbances, distractions, especially in our clinics. With the use of these simple medicines, it can be cured.
And now my patient in 3 years, and he was very complicated, but now he is fully well, and in the entering in the 4 year also. My patient Shayan, looking beautiful and a red face, healthy, and want to go to school, and showing the good manners in a family, sympathy with the mother, but now he is not a chamomilla.
Yes, there's a request. Please differentiate with tarantula. Please differentiate with the tarantula. I think chamomilla and tarantula. What is your answer? That of tarantula.
Yes, yes.
How will you differentiate between tarantula and this chamomilla?
It's too different. Chamomilla is always irritable personality by a nervous, and all of the medicines have the different personalities and different nature naturally. Just like human have that different status and different from the family. We should to see that and observe the status of the patient and health status of the patient. We should to categorize, and we should to must see the stage of the disease also. And especially today I'm sharing about the children's, and especially children's are tantrum tempered, got the and received the from of the society, and got the from the depression. All of the children's, and in a good family, in a cool tempered family, have no tantrum and tempered children's, but it have naturally have the cause from the family, from the mother. So all medicines are the different and have the different tempered. Today we are talking about the chamomile only. Anyone want to ask something?
Okay. Dr. Jacob.
Cyanide and chamomile. Very I mean, we cannot understand mostly 80% rubrics and 80% all symptoms are matching in both of them. So sometimes we cannot.
Okay. Yes. Dr. Jacob Matthew, what is your comment on this case, please?
Dr. Manoj, unfortunately, I was not in front of the computer by that time. I was with a patient. I didn't get chance to hear the whole session.
Okay.
Sorry about that.
Okay. Yes, there is a problem. The time difference is
Yeah, that's a big.
I think there
This
is
is our
around
peak hours.
noon that time. It's America, isn't it?
This is 11:48 right now.
Yes, busy in practice. Okay, now Dr. Muhammad Ali. Yes. Could you please unmute, Dr. Muhammad Ali? Please unmute. What is your comment? Please make your comments. Yeah.
Thank you, sir. Good evening. Assalamu alaikum. Once again, a very nice and beautiful series of presentation through platform of IFPH. I congratulate to all of your team of IFPH and also congratulate to Ma'am Tanzila, which present a very nice and such a beautiful case of chamomilla in which approach by Segal method and see the different version. Temper tantrum, which is really a very unique and guideline for prescribe homeopathy, really which is a very beautiful version, and logged at front disposed different version is seen by in this case. This is a beauty of homeopathy in which we see the cure, not palliation. Cure by homeopathy, such a minor dose of medicine and cure the patient. And we see the children are not express their expression, and which are totally different from for a cure. But when we see the eyes of Segal method or observation, we approach the true approach to the case. Thank you, sir. And once again, I appreciate to your team which continue unbreakable, uninterrupted presentation of 1521 days. Thank you, sir. Very nice, sir. Thank you.
Thank you, Dr.
Thank
Muhammad Ali, for participating. What about the potency, dose, and repetition in this case, Dr. Tanzila?
Sir, I want to share something about the chamomilla. I was forget that.
Okay,
now.
no problem, please.
This is the single chamomilla. You can see there is repertory from the radaropus, and this is synthesis. Respiration, breathing, holding breath, anger from children in only single chamomilla. This is the chapter of the lungs. And in chamomilla, I have the respiration, anger respiration difficult with, you can see there is 14 medicine. And mind, emotion, respiration with the complaints of, this is chamomilla, and with chamomilla with this 6 medicines. Hysteria, respiration with the complaints in the people have the 21 medicines. And there is the respiration arrested suddenly in children, only single chamomile. This is the respiration arrested suddenly in this. So we should to must remind the chamomilla respiration arrested eating after. When patient taking the feed after the nursing, restlessness after nursing, this is a beautiful rubric of the chamomilla. After eating aggravation and sometimes patient have no and contracting chest and feeling the anxiety and restlessness after eating. So we should too must remind the chamomilla because remember that patients emotionally involved in the temper tantrum and irritate. Chamomilla always irritate by the nervous system. So respiration arrested eating after chamomilla. This is a very rare medicines we are not using. And this is a beautiful rubric of the holding breath, anger from in children because of the temper tantrum and the children and infants cannot share and cannot express their emotions. So this is the very single chamomile. This was
Yes. That is why often our medicines are mentioned, indicated to in children, belladonna, chamomilla, senna, so many medicines are there. Then adopted to women of this age or that age. So whenever you prescribe the medicine, that area should also be addressed so that we'll definitely reach the remedy. Then you don't make it. Dr. Ansila, yes. What about the potency you prescribe in that case?
1M.
1M potency. About dose repetition?
I was repeated in a 30, I think 2 time or 3 time because patient was the lyntric also. Yes. And when he was eating the food and he was mother used the pamper and he was catch the pictures and send me. I see that the food in all food in just he was not chewed something. So I see that the beans and carrot and tomato in original form in the stools. So he was lyntric also. Then I was repeated in a 30. So he was cleared the situation of patient.
To what? Whether you give medicine to a child or to the mother?
Yes, sir.
Through the child or to the mother or the child?
I was not used the other remedy. Mostly when he visited there, so he got the sometime physical issues. So I always given the chemo in 6. So he cleared the symptoms. I was not changed the remedy. In complicated cases, we are giving the management of the case, management of the food and by the nature with the single remedy treatment. But we are not, I think we should not give the any other potency with the other potency. There is a...
Okay. What about the scope of or the level of practice at Pakistan right now?
Sir, sorry, sir, I was not understand. Sir, please.
How is your practice progressing in Pakistan? The number of patients or is increasing or still in a standstill condition? Not only for your case, but all over Pakistan.
Sir, people there is not understand.
Yes, yeah, please unmute, Dr. Ansila.
Sir, patient not understand about the homeopathy in this Pakistan, especially because people sometime due to the lack of knowledge and sometime need the quick result. So most of people, 60% people using the allopathic system, and but now we are awareing the people, and because of the ignorance of the homeopathy, they are using the packets, they are using the mixed medicines, and in form of the tablets and beautiful packets of the tablets. So patients untrusted the ignorant people, and good doctors showing their qualities, and now people are understanding about the homeopathy, and I mean 40% people using the homeopathy, but finding the good homeopath.
Yes, a lot of hard work is needed. I think was also from the support of media is also an important thing. It's time to conclude the session. May I invite Abdul Salam, sir. Please express vote of thanks, Dr. Tanzila. Sir, are you there? Abdul Salam, sir. Yes.
Sorry, I was getting ready for duty. Okay, whatever it is. On behalf of IFPH, I would like to express my gratitude and thanks for Dr. Tanzila and all our guests.
Thank you so much, Dr. Abdul Salam. Thank you.
Yes, there are a lot of persons like Mr. Abdul Salam, who is always supporting this IFPH as well as promoting homeopathy more than homeopathic physicians all over the world. That's the most wonderful and interesting thing. So we must salute him for his endeavor to bring a lot of faculties and guests to this platform and doing hard work to promote homeopathy. So great salute, Mr. Abdul Salam sir, for that. The remarks will be conclude today's English edition. Hope you that will be back again tomorrow, the same time. Till then, goodbye. And Dr. Mariama John to continue the program in Malayalam.
Thank you so much, all of you. Take care.